Greetings and welcome to the Cancer Interviews podcast. I'm your host, Bruce Morton. A colon cancer journey can be especially difficult because of the degree to which the patient has to be his or her own caregiver. That was just part of the journey for Freda Botha of Port Elizabeth, South Africa. But she has not only survived, she's doing all she can to help others on their colon cancer journey. So here she is. And Freda, welcome to Cancer Interviews.
Good morning, Bruce, and thank you for having me.
And the first thing I would like to know, and that we would like to know, our audience, is just a little bit more about you, because you have a life exclusive of your cancer journey. So if you would, Freda, tell us a bit about where you're from, what you do for work, and when time allows, what you do for fun.
Okay. I'm 47 years old. I live in Port Elizabeth. I am a secretary. I'm the youngest of 5 children. So it's quite a big. I have to read and watch movies and go with my friends and stuff to places.
All right. Now, if you would describe what life was like prior to your diagnosis. I hope it was pretty close to normal. I hope it was pretty close to healthy. But what were things like for you from a health standpoint before your diagnosis?
Yeah, it was actually very well. I didn't really visit the doctor. That is one thing that is part of me. Is like, if I tell you I need to go to the doctor, I'm ill. That was something I never used to do. My health was, according to my knowledge, my health was very good. I didn't go see the doctor. Tried to keep healthy and keep myself active and everything like that. So it was normal.
But at some point, something must have surfaced, something must have materialized that seemed abnormal. Just what was that, and how did it manifest itself?
Bruce, it was something that was over like a period of a few weeks. From feeling fine and healthy to being so tired that when I'm at work, sitting working, I could actually fall asleep. I was so tired the whole time. I got constipated, couldn't eat. It came to a point where, the egg yolk of a boiled egg, I couldn't get that in. It felt like everything was just sitting here and nothing would go down anymore. And it got worse and worse. And eventually I had such pain that I said, I can't take it anymore. I will need to go and see.
Now, when that happened, did you go to your primary care physician, or
No,
did you feel
it got too bad?
Or did you go to see a specialist?
No, I actually just went to go see the normal house doctor, and then he recommended me going for x-rays at our state hospital, provincial, as I didn't have a medical. So I went to them for x-rays, and after them looking at the x-rays, they transferred me over to the other state hospital, where they said I would need to see a doctor and a specialist. It looked like air bubbles that formed in the gut, and they couldn't understand what caused it. So they wanted me to see a doctor regarding that, yeah.
And what happened next?
Okay, so then they started treating for the air bubbles to see if the air bubbles would come out on their own. They decided then to operate and see if they could, help with the air bubbles, What was supposed to be like an hour or hour and a half operation ended up being a 6-hour operation. Because when they opened up, they realized there was polyps on the colon, and they had to take for biopsy. It was so bad that they had to take a piece of the colon away. They put a Stoma Bag on. Nothing that a person was prepared for before the time, because they never realized what it would look like on the inside. So yeah, it was a 6-hour operation. It was about a week in ICU. And I'm honest with you, from that time, there's very little that I can remember. I was nearly a month in hospital after the first operation.
And emotionally, how difficult was that?
It was a shock, because you weren't prepared for it. You were prepared for something small, waking up, finding out you had a stoma bag. It was actually a 6-hour operation. You were in ICU for a week, and you didn't even realize all this was happening. It was like vague, when you have these recalls from a dream, and you think, this didn't happen to me. That's what it felt like. So yeah, it was total shock to the system. It was eye-opening to see how quickly a person's life could change, actually. Yeah.
Now, you've mentioned the procedure that was far more detailed and invasive than you had anticipated, but at what point did your care team tell you that you had cancer?
Okay, so after the operation, they did tell me that they found the growths, that they have sent it away to have biopsied. So it was, I think, about, the time after I came out of the ICU, and I was more aware of what was going on around me, what they tried to explain to me. But your brain is like, this is not happening to me. This is like, you feel like it's someone else's story that they're trying to tell you. So they came back with the results, and it was positive, and it still felt like it's not happening to you. And then the realization starts to come to you, and you realize, but this is what's happening. You do have cancer. What do you do now? So there's so many things that are going through your head at that time.
Freda, each type of cancer has its own, for lack of a better word, personality and its own idiosyncrasies, its own challenges. Some types of cancer present you with treatment options, others don't. Did you have treatment options?
They recommended me going for chemo. So I went from May to December, I think it was 2008. Yeah, 2008 I was diagnosed. 2010 I went for chemo from May to December. It was like every week or every second week I used to go. It was just an injection that they gave in my hand. So it wasn't, I don't mean offense to anyone, but for me it wasn't as bad as some of the people that I was seeing that was with me that was receiving much harsher treatment, if I can put it that way. I wasn't on a drip. I wasn't ill from the treatment. I was very tired from the treatment. That was one thing that they would say from the beginning, is you're not supposed to drive. Don't go back to work. It will make you very tired. I was very, if I can say it that way, lucky in the sense that the only effects that I had was the tiredness. So a little bit of hair loss, not much. If you brushed your hair would come out. A bit of a loss of appetite, but I wasn't sick or throwing up or anything like that. So in that sense, if I can put it like that, I was lucky in that sense. Yeah.
By the way, if you like what you hear on this segment, we invite you to subscribe to our podcast by clicking on the links below. Once there, you will see a bell icon. If you click on that, we will notify you when we post a new interview. Now, Freda, you had to deal with kind of a difficult 1-2 punch, chemo and then the stoma bag, and I want to address both. But first with chemo, you had briefly mentioned the hair loss, and it wasn't as bad as maybe it was for other women, but I think more so for women than for men, the hair loss component is tougher for women than for men. Yeah. How difficult for you was it when you experienced the hair loss?
In the beginning, it was bad, because I was just thinking of, if I have to lose my hair, am I going to be brave enough, gutsy enough to actually shave off all my hair? But luckily, I like wearing my hair short, so that was a plus point. It wasn't that much of a thing, but that was one thing that did bother me. But I think as time went on and I realized I'm not having as bad hair loss, it was more like little bits at a time. You tend to accept it more. Yeah.
If I'm hearing you correctly, it sounds like the most difficult part of the chemo component of your journey was the fatigue. Is that fair to say, or were there other components that were also really difficult?
Oh, no, the fatigue. And that's something that I still have today, that if I feel tired, I go and I rest. I know it. The doctor used to tell me that time, your body knows what it needs. So if you're tired, you need to go and rest, because that is what your body needs. But the fatigue was definitely my main thing, yeah.
Now let's talk about the stoma bag, which you awoke with after your procedure. And this is what I referenced in the intro of a colon cancer sufferer having to at times be their own caregiver, because maintaining a stoma bag is no easy task. So if you would, it was somebody else who, for lack of a better word, installed the stoma bag, but once you were out of hospital, you're the one who had to maintain it. How difficult was that?
I think my whole journey, that was my most difficult part. It tends to go according to the person you have that's showing you what to do once you start off with a stoma bag. So in the beginning, there was a carer that was very, you need to know how to do this. You need to do this on your own, and this is what you do, not actually letting you do it and helping you doing it. So that was a bit difficult in the beginning. And then there was a different carer again that was more sympathetic to your problems. And if you used to say to, honestly, it makes you, for the first time, if you have to do it, you actually feel sick. You just want to throw up, because it's feces and it's stuff that you're not used to. So she came with tips of what to do. Use vanilla essence water to rinse the bag with, things like that. So that helped a lot. And then when you got home, it all started from the beginning, because now you had to help yourself. I was lucky to have my sister and my family and them to help me with it. It was really learning trial by error. You knew what happens in the hospital is totally different to what happens at home. Because at the hospital, you basically lie in a hospital bed. You don't move around. So the stoma bag stays one position. It gets emptied a different way. So when you get home, it's totally different, because you move around. When you sit, you lie down. By us. So in the beginning, the bag wouldn't stick to your body. The bag would leak. So I started having this phobia of going anywhere, because what would happen if the bag leaked and stuff like that. So that made it very difficult. Yeah.
Freda, I want to ask your advice, and this advice would go to anybody who has learned that they could be a candidate for colon cancer, or somebody who's been freshly diagnosed. For this, the stoma bag piece of all this, what advice would you give to someone when they're still in hospital in terms of those who can help them along? Would you suggest that they insist that they get the right amount of assistance?
Don't be afraid to ask questions.
What would you suggest?
Yeah, don't be afraid to ask questions. If you're not sure of it, don't just ask the staff that are just working with the stoma bags, because ask the normal nurses as well. Those people work with it every day. The stoma nurses come around and they explain to you in the beginning, but the normal nursing staff is the ones that work with you every day with it. So don't be afraid to ask them questions. Ask your doctor questions. That's the best thing you can do, is ask as much questions as what you can. If you can think of something, write it down and ask them when you see them.
Now, with the stoma bag, I'm guessing there would be the possibility that it might have compromised what you did in terms of where you went and what you did, say socially or anything else like that. While you had the stoma bag, was there anything that you couldn't do, anything that you were hesitant to do?
Yeah, swimming, going into water. Even when you take a shower, you need to take the stoma bag off, because that stickiness doesn't it doesn't stay sticky too long. And like by us, we used to get a certain amount of stoma bags. Sorry. Sorry, man. We used to get a certain amount of stoma bags to use in a month. So you were very careful of what you were doing as not to let the glue and stuff, go soft or come loose or stuff like that. Eventually, I started buying my own stoma bags to not compensate, but to add on to what I was getting every month as well. But definitely swimming, that was one thing I didn't do at all. Yeah. And you were very, very careful of where you were going, and if you were going anywhere, of what you were eating. Yeah.
And you had the stoma bag for how long?
The stoma bag was, I think, 4 months. Then I had a reversal. I went back again for yearly checkups. They found a growth again. So I went again for an operation where it was once on the left side and then the other time on the right side. So that was also quite an adaptation, because it was definitely totally different to what it was on the other side. But I had it twice already. And the last time I went, I had a growth as well. And the doctor said if he couldn't remove the growth via a colonoscopy, I would have had to have the bag permanently. So thankfully, they were able to remove everything, and it wasn't necessary so far.
So it sounds like the treatment part of your cancer journey was moving in the right direction. It sounds like you were getting to the point in which you were starting to get the best of colon cancer. You were getting the upper hand. How did that feel to know that things were going in the right direction?
It's actually quite a relief, because it is something that is worrying you the whole time. It's something that's in the back of your head. It's a relief. It's a relief knowing that I'm still going for my yearly checkups, but I go, but I feel positive when I go that everything is going to be fine when I go.
To some degree, you've already answered this question, but I'm going to ask it again so you can elaborate a little bit. You had mentioned that family and or friends helped you with the stoma bag, but there are other support-related necessities during a cancer-related journey, both mentally and emotionally. Who provided that support, and how do they provide it?
Okay, cancer played a role in that by giving support, giving information to you. One thing I can say to people is try not to Google. That is everyone's first instinct, is to Google what is wrong with them and what to dingus is. But rather go to your cancer association and ask them for help. They have a dedicated support group. They can help you if you don't have any stoma bags, stuff like that. And our staff partner was wonderful in his support and checking up and, just helping. And not just him, but the people from cancer as well.
Okay, and when you say cancer, you're talking about Cancer Action Network of South Africa, of which you are a part, and we want to address that in just a second. But first of all, for somebody who has never heard of cancer, CANSA, for somebody who's never heard of cancer, whether they're in South Africa or anywhere else in the world, what can cancer do for that person who's been freshly diagnosed?
Okay. They've got a lot of, I made a note of it so I can tell you. So they've got different ways that they help people. They've got clinical breast examinations. They do pap smears. They do blood tests for prostate cancer. They do medical equipment hire, wig hires. They do volunteer recruitments, like people like me that help. They do telecounseling. So that is something new that they've incorporated now. and they are doing it in all our home languages. So it's not to say you are going to only help in English or Afrikaans. It's in all 7 languages you will be able to be helped.
And I think I have the correct web address for cancer, Freda, and please correct me if I'm wrong, but it would be cansa.org.za. can.org.za. That is the correct web address,
Yeah.
yes? Okay,
it's
so
cansa.org.za. Yeah.
yes, and so if you have any needs that are cancer related for the cancer journey, or if you know somebody who's on a cancer journey, that is a wonderful one-stop place to go to get that help. Now let's talk about your involvement with cancer, your volunteer work, and anything else you do. What do you do, Freda?
Okay, so I am a volunteer by cancer. The Global Heroes of Hope is an American Cancer Society part of the relay, and I was selected in 2020 as a Global Hero of Hope. So Global Heroes of Hope is cancer survivors and caregivers that are ambassadors for our cancer organizations. And there are about 270, I think 280 of us now across the world already. I also volunteer for our local relay. It's our flagship fundraising event. Yeah. That's it. Yeah.
And again, what is the name of that relay event?
Okay, it's just the Cancer Relay for Life. So if you go onto the cancer website, and you can just type in Relay for Life, and all the Relay for Life information will come up there as well.
Because the internet is involved, do you find yourself in touch with people on cancer journeys, not just in South Africa, but all over Africa, all over the world?
Oh yeah, definitely. As a Global Hero of Hope, I'm also the Global Hero of Hope team leader for Africa. So that is, it's not just for South Africa, it is for South Africa, Zambia, Zimbabwe, and Kenya as well. And you get to meet all these people, even the Cancer Alliance that's on Facebook. So there are a lot of groups on Facebook that you can join, but just to make sure that they are legitimate groups. Yeah. But yeah, I've connected with a lot of people from across the world with it, yeah.
And for you, and for, I suspect, any cancer volunteer, how fulfilling is that?
Very. So you meet so many people, you hear so many inspirational stories, and you realize in the beginning, it wasn't something that people talked about. It was like, oh, I've got cancer, so I've got to stay at home. I mustn't tell people about it. I don't know. I won't say people were embarrassed about it. It was more like society wasn't ready for it. And I think with being involved as a volunteer, you realize more and more that your story is not the only story. There are a lot of stories out there that are the same as what yours is.
And I'm guessing you also find that, at least I hope so, that your work as a volunteer, when you reach out to somebody, that it's either fulfilling for them, or perhaps better yet, inspirational and educational. Is that fair to say?
Yeah, it's true. Yeah, we always try and help them. Like I said, directing them to the correct people or sites or toll-free numbers or groups to help them for their specific needs. Yeah, very fulfilling to be able to help someone. Or even if now with my role as a Global Hero of Hope, I get a lot of people reaching out to me on Facebook saying, this is what's happened. What do I do? Who can I contact for help? So it's fulfilling to know that people see your story and people realize there is someone out there that can help me.
All right, Freda, let's get back to your cancer journey. I had mentioned, or I had asked earlier, what couldn't you do with the stoma bag? Thankfully, the stoma bag is in your rear view mirror, but in a sense, you are still on a cancer journey. So in terms of physically, socially, anything else, what can you do now and what can you not do now?
Okay, basically, I can do everything like that I did before. The one thing I am very careful is stuff that I eat, because I know what makes me feel well, what doesn't make me feel well. Things that never used to bother me, like warm, hot food, like in curries and stuff like that. If I go somewhere, I tend to know I should not have that. It's not good for me. Small things, strawberries, stuff with little pips in it, because that time they said that sticks to your colon, and that's how a polyp can form. So in your back of your mind, you think, oh, I love strawberries, but I shouldn't eat them, you know. So it's things like that. But I still do what I always done. So it's luckily not something that's kept me back.
That's fabulous. That is wonderful to hear. And I hope for people watching and listening, that provides a measure of inspiration as well, that they can get to the same point that you have arrived at. Freda, we're going to wrap things up now. And when we wrap things up, we always try to pose the same question to our guest. And that question is as follows. And this is, I suspect this is a road you've traveled down many times, and so this question will be a very easy one for you to answer. But if you encountered somebody who had been freshly diagnosed with colon cancer, or they learned that there was a very strong possibility they could be diagnosed, if you had a message for that person and there was one overarching portion of that message, what would it be?
Take it one day at a time. Take it one day at a time. It's very overwhelming in the beginning, but just take it one day at a time. And I always believe that life is 10% what happens to me and 90% of what I make of it. So it doesn't help to overstress yourself and try and overthink this stuff. Just take it one day at a time. If you can get past today and you can survive today, tomorrow will be better, and the next day will be better, and the next day will be better. Just take it one day at a time. And if it gets bad, just start again. Just start again from day one, and just start again.
All right, wise words. Our guest has been Freda Botha of Port Elizabeth, South Africa. And Freda, thanks so much for numerous kernels of information that, again, can be both educational and inspirational. So, Freda, thanks so much for your time.
Oh, thanks for having me, Bruce. I quite enjoyed it. Thanks.
And that's going to conclude this segment of Cancer Interviews. And again, we want to drive home the message that if you are on a cancer journey, or if a loved one is on a cancer journey, you are not alone. There are plenty of people out there just like Freda who can help you on your way and make that journey just a little bit easier. So until next time, we'll see you on down the road.
Thanks for joining us today. For more information, please visit us online at cancerinterviews.com. We appreciate you tuning in, and we'll see you back here again next time on the Cancer Interviews Podcast.